continent in crisis, how the U.S. anti-vax movement is fueling a measles resurgence across the Americas. The Americas, once a beacon of measles eradication, are now facing a devastating resurgence. Experts point a finger squarely at the U.S., where a surge in anti-vaccine sentiment, fueled by political rhetoric and misinformation, is having ripple effects across borders. But here's where it gets controversial. While the U.S. grapples with its own outbreak, its influence on neighboring countries is undeniable. Latin America, already struggling with healthcare disparities, is now seeing a 34-fold increase in measles cases this year, mirroring the U.S. crisis. This alarming trend, documented by the Pan American Health Organization, PAHO, highlights the interconnectedness of global health and the dangerous consequences of vaccine hesitancy. And this is the part most people miss. The impact isn't just about numbers. Measles, a highly contagious disease once thought conquered, can lead to severe complications and even death, particularly in vulnerable populations like children and the immunocompromised. The resurgence threatens to undo decades of progress, pushing the continent dangerously close to losing its hard-won measles-free status. Countries like Brazil, Mexico, and Bolivia are scrambling to respond. Brazil, for instance, has launched a nationwide vaccination campaign targeting children and teenagers, while also implementing swift ring vaccination strategies around confirmed cases. Mexico, the hardest-hit country in Latin America, is battling over 4,800 cases and 22 deaths. Bolivia, facing 354 cases, declared a national health emergency, extended school holidays, and launched a mass vaccination drive reliant on international donations. The blame game is easy, but the solution is complex. While the U.S. anti-vax movement, amplified by figures like Robert F. Kennedy Jr., undoubtedly plays a significant role, other factors contribute to the crisis. Unequal access to healthcare, particularly in rural and marginalized communities, leaves many vulnerable. Additionally, the COVID-19 pandemic disrupted vaccination schedules, further weakening herd immunity. Here's the harsh reality. Measles is entirely preventable with 2 doses of the MMR vaccine, which boasts a 97% effectiveness rate. Yet, vaccination rates in Latin America, though recovering since 2022, still fall below the 95% threshold needed for herd immunity. This gap, coupled with the spread of misinformation and the influence of the U.S. anti-vax movement, creates a perfect storm for outbreaks. So, what's the way forward? Experts emphasize the need for a multi-pronged approach. Combating misinformation, public health campaigns must actively counter false narratives about vaccine safety, utilizing trusted community leaders and accessible communication channels. Strengthening healthcare systems. Ensuring equitable access to vaccines, particularly in underserved areas, is crucial. This includes addressing logistical challenges and building trust within communities. International cooperation, sharing resources, best practices, and vaccine doses across borders is essential to contain the spread and prevent further outbreaks. Addressing the root causes of vaccine hesitancy, understanding the underlying fears and concerns driving hesitancy is key to developing effective strategies for building trust and confidence in vaccines. The measles resurgence in the Americas is a stark reminder of the fragility of our progress against preventable diseases. It's a call to action, demanding global solidarity, evidence-based policies, and a renewed commitment to public health. The question remains: will we learn from this crisis and prioritize collective well-being? Or will we allow misinformation and fear to dictate our future? The answer lies not just in vaccines, but in our collective willingness to protect the most vulnerable among us. What do you think? Is the U.S. anti-vax movement solely to blame? Or are there other factors at play? How can we effectively combat vaccine hesitancy and ensure global health security?